everyone! Welcome to the video on interacting with children with intellectual disability in the healthcare setting. Individuals with intellectual disability or global developmental delay if aged below 5 years are known to have higher healthcare needs compared to someone who is typically developing. These healthcare needs include increased risk of obesity, metabolic syndrome, epilepsy, feeding and sleep issues, etc. However, there are significant barriers and inequalities in accessing healthcare for this group of individuals. This could stem from patient factors such as difficulties with communication, mobility limitations, etc. Healthcare workers may also have limited training on the healthcare needs of such individuals or how best to engage with them or their carers. There could be misregard for the carer's complaints or diagnostic overshadowing in which the individual's symptoms are wrongly attributed to his or her underlying intellectual disability. In this video, I will be discussing what intellectual disability is and what are some of the strategies we can use to facilitate our interactions with such individuals in the healthcare setting. An individual with intellectual disability has significant difficulties in intellectual and adaptive functioning originating prior to 18 years old. As a rough guide, a full-scale IQ score of 70 to 75 means that the individual has significantly limited intellectual functioning. However, there can be discrepancies in the score on the various subtests which preclude the calculation of a full-scale IQ, or when a full-scale IQ may not accurately reflect the overall intellectual function of the individual. Discussing this is beyond the scope of this session. Typically, the term global developmental delay is used when the child is below the age of 5 years. We will discuss some factors that may facilitate the encounter with a child with developmental delay or intellectual disability. As a healthcare worker, equipping oneself with knowledge of the healthcare needs of such an individual is imperative. This is beyond the scope of this presentation, but we will discuss how we can modify our approach when we meet a child with special needs. Firstly, the way we communicate with the child has to be modified. Language use should be aligned with the child's developmental age. Of note, the child could have varying degrees of delays or impairment in the different developmental domains. Find out from the caregiver if the child uses any alternative and augmentative communication system. Speak succinctly. Give clear instructions. Avoid asking too many questions. Do not assume that the child does not understand what is going on. He or she will still feel anxiety and pain, just like any of us. Do engage the child and inform the child of what you will be doing beforehand. Avoid ignoring the child or speaking over the child. Break the task down into smaller steps and guide the child along the way. Give prompt and specific praise to encourage the child. Visual aids such as pictures may be more accessible to the child. For example, in place of a verbal pain score, the Wong-Baker Faces Pain Rating Scale can be used instead. Visual schedules may also be helpful for the child. Engage the child's caregiver. This person knows the child best and will be able to provide you with information on the child's needs and feelings, how the child communicates pain, what will help the child feel better, and what could trigger off negative behaviors. Allowing the caregiver to be present, if possible, would also help the child feel less anxious. Be vigilant to the child's cues, especially for pain or distress, as he or she may not communicate this verbally. Some of these children may be on medications for various reasons, for example, for aggression or seizures. Some medications may also cause the child to be drowsy. Know the child's medication regimen and medication properties so that you can time the encounter optimally. Before we end the video, let's recap. Children with intellectual disability have higher healthcare needs compared to neurotypical children. One of the barriers to receiving good healthcare in such individuals is inadequate training of the healthcare worker. We have discussed some strategies that may help facilitate this encounter.